Absolutely.
Great. Welcome to today's Wellness Wednesday with Orient. My name is Anne, and I am a health coach here at Orient and also the webinar moderator. And we are so grateful to have Dr. Kaylan Baban with us again. She joined us last month and taught us a lot about mindfulness and the mind-body connection, and she's back again today with us to also share her insight. She is a doctor at George Washington University, where she specializes in mindfulness and preventative medicine. Do you want to, I hate to just put you on the spot, but will you tell us a little bit more about your passion, what you do? Because you'll do a better job explaining what you do instead of me.
Absolutely, I'd be happy to. So my role at George Washington University, as you mentioned, Anne, is serving as a preventive medicine and lifestyle medicine physician there. So I run our lifestyle medicine program, and I'm also serving as our chief wellness officer for the School of Medicine. So the areas that I focus in and that really kind of keep me moving day to day and get me really excited are on all of the things that affect someone's health that are related to day-to-day life. So not things that happen in an exam room, not necessarily things that we are writing prescriptions for, but just the day-to-day choices that we make that we know can have an enormous impact on our health and can either prevent us from getting sick in the first place or can help us to return to a state of health and really prevent us from developing any further health problems once they've arisen. So those are things like dietary habits, physical activity, sleep, stress management, mind-body tools. These are all things that we know have an enormous impact on our health and the kinds of health conditions that we either develop or manage to avoid. So those are things I get really excited about, and I'm always happy to speak with people about.
Well, we are really excited to hear what you have to share with us today. And really this niche, this area of focus that you have with wellness is so needed. And I think is so applicable to everyone, regardless of your health status, your age, where you live. We all are doing our best to right manage our health. And really our health is really for the most part, as you talk to people, one of their main priorities, even if we don't give it priority in our day to day, which is where this really comes in and helping us keep ourselves on that list of priorities and doing our best to self-care as best
Well,
we
it's so
can.
foundational to everything that we do, right?
Absolutely.
Whatever it is that's important to us in our lives, if we don't have our health, everything else is a little bit more difficult. And everyone is not going to be able to be in the same peak physical condition, but we know that everyone does have their own personal best health that they can reach, and these are some of the tools that can really make a difference there.
Well, I'm excited to hear what you have to share with us. So, like last time, just let me know when you're ready for the next slide, and I'll just turn the reins over to you, and we'll get going.
Okay, great. Thank you very much. And I know last time we hadn't ended up having a lot of time for questions. I'm hoping that we'll have a little bit of time this time. But we can
Excellent.
also take questions as we go.
Yes, and just for everyone on the line, this is generally around 30 minutes. We like to be a little bit flexible because in past presentations, everyone's like, we ran out of time, we want more. So at the 30-minute mark, if we're not quite wrapped up and you need to jump off, go ahead and jump off, but we'll make sure we take questions at the end or whatever as we get through it. So
Great.
thanks.
Okay, thanks, Anne. Okay, so today we're going to be speaking a little bit about living and sleeping mindfully. So what is mindfulness? If we can go to that slide. This is a question that we had covered a little bit in the previous session. For purposes of catching up anyone who wasn't at the previous session, we can go to the next slide and take a look at the definition from Dr. John Kabat-Zinn, who really developed the non-secular practice of mindfulness and brought it to the United States in the 1970s. So he described mindfulness as paying attention in the present moment and without judgment. And so another way of thinking about this is being able to direct our attention or awareness in a way that's intentional and in a way in which we are responding intentionally rather than reacting with kind of reflex emotions. And mindfulness practices that can help us to achieve this state of mindfulness, of intentional awareness, they can take many different forms. So among those forms, some of the possibilities are here. And these are formal practices that I've demonstrated here, including things like Tai Chi, walking meditation, seated formal meditation, biofeedback. But there are informal options as well, which we'll spend some time talking about today. These are practices that can be seated or moving alone or in a group and can take any amount of time at all, from seconds to weeks. If we go to the next slide, just about anything can be done mindfully. This is one of the things that we had touched on previously. Finding an activity that you enjoy engaging in, anything that you might like to be really bringing your attention to can be done mindfully, including any of the examples that are here. Why does this matter? Next slide, please. We know that when we are experiencing a great deal of stress, that stress, either acutely or certainly chronically over the long term, has a real effect on our health, on our physical health as well as emotional. And these are some examples of health conditions that we know can be exacerbated by stress. Similarly, though, we know that engaging in mindfulness practice and having a practice that you engage in regularly, ideally for at least a few minutes once or twice a day, also can really make a difference in these same health conditions and can help to better manage them and, in fact, in some cases, help to reverse them. Next slide, please. So if we speak about living mindfully, what is lived mindfulness? Next slide, please. What we spent some time speaking about in the last session was the concept of engaging a relaxation response through use of mindfulness practice, which is the opposite of our stress response in the sense that it is part of what we refer to as our autonomic nervous system that results in reducing our heartbeat, reducing our respiratory rate, reducing all of those stress and inflammatory markers and bringing us into a state of physiological relaxation. So that's one of the things that results when we are living a mindful life, including the use of these mindfulness tools. The other thing that can happen is that we can really be much more effective in changing behaviors or patterns of behavior that we want to change and in sustaining those changes. If we go to the next slide, I think this is a quote that can help us to really better understand why that can be. Why is mindfulness so supportive of behavior change? This is a quote from R.D. Laing, and we'll just read it here. The range of what we think and do is limited by what we fail to notice. And because we fail to notice that we fail to notice, there's little we can do to change until we notice how failing to notice shapes our thoughts and deeds. And if we imagine any of the types of behaviors that we sort of do habitually without even thinking about it, that we may not even know why we're doing, that may not be the healthiest for us, this suddenly becomes a very relevant quote. And I think you can understand here how the use of mindfulness practice and really living your day moment to moment as mindfully as possible can really help to support and sustain those kinds of behavior changes you may be interested in starting to incorporate, including really just helping you to be more aware of when stressors are arising and managing them proactively, which is oftentimes where a lot of our not so healthy behaviors derive from. Next slide, please. So when we're speaking about lived mindfulness, what this is really referring to is a state of mind, a state of being, and a way of behaving. So this would include being aware of our own needs as they arise, instead of sort of continuing to push past them and maybe not being aware of them until they really rise up and won't be ignored. So being aware of our needs and being intentional in providing our self-care. Being present in a mindful manner with all the people in our lives, be that our clients, colleagues, friends, family, strangers, being aware of our surroundings and present with them. And also really bringing attention to systems and institutions that could support and promote mindfulness and thinking a little bit structurally about what it is that we can help to move the needle on there. Next slide, please.
Can I interrupt right here really quick? I have a
question. Of course, yeah.
About this slide. So when you're saying living mindful and you're talking about being aware of ourselves and our presence, is this something like, for instance, if you're running around town and people run around with their headphones on, not really paying attention, not really engaging, we're maybe not engaging. Is this kind of what you're referring to as well? Like,
That's exactly right. Exactly. When we are running around town or running around our offices or running around our homes or wherever we're running around, usually, of course, we're running around, right? And generally speaking, the vast majority of the time, if we are not intentionally being mindful, we are probably mindless, meaning that we are probably not really aware of our surroundings, not really aware of the people around us, not really aware of how we are feeling. Our minds are often running on what we need to do later in the day, what we should be doing now that we aren't doing, what went wrong earlier today that we wish had gone differently. We're usually doing 50 different things at once. That's exactly what I'm referring to. So the idea is being able to really be intentional about what you're doing, rather than the phenomenon of suddenly arriving where you're going and having no idea how you got there, for example.
excellent. That makes a good point. I kind of talk to my children about this as zombie mode, right? Where we're just kind of little zombies running
Mm-hmm.
around without really being present and with each other.
That is a great description. That's exactly right. And so you can imagine that means that there are a lot of missed opportunities, for one thing, for engaging with others around you. It also means that there are a lot of missed opportunities for really better understanding and identifying what's happening with you and what you need. And I think there's a fallacy that when we are in that state, we are more efficient. But we know that that tends not to be the case. Regular mindfulness practice and scoring higher on mindfulness surveys that have been validated is actually much better correlated with having better cognitive function, being more attentive, being more efficient, having greater productivity.
Excellent.
So
This
we just
makes a lot
feel
of
like
sense.
we're being busier and more efficient when we're running around in zombie
Yeah,
mode.
and it just all gets real complicated at that point. Awesome. I love it.
Okay, so yes, let's go to the next slide then. So as you can imagine then, the implications here are not just for ourselves, but also for the people around us. So to use your phrase, Anne, most people don't think of zombies as being the sort of warmest, most caring people. When we are being more mindful, when we are taking better care of ourselves and what we need, that kind of self-care really can have important implications for the people around us and can be a very selfless act. So we know that when we are practicing mindfulness regularly, consistently, when we are more mindful in our day-to-day lives, that has the impact that we are more present. In being more present, we are more empathic. We are less emotionally reactive, so meaning instead of sort of quick knee-jerk reflex reactions or to any triggers that may arise, we can really be more intentional in our responses. And we can be more effective role models for the folks around us. So that's the whole do as I do, not as I say. So the next slide, please. We also know that when we are engaging in this kind of self-care and awareness of our needs, awareness of our inner emotional state, there's a big boost to professional performance. And so we've just been speaking about some of the reasons that that might be true. This is obviously not in a completely scientific graph here. Complete meltdown is not a medical term. But what we're describing here is essentially the idea that everyone has a kind of peak area of performance. Everyone has an area where they have just enough stimulus, just enough stress, that they really have something to work on, something to motivate them and keep them focused, and yet have not crossed over into an area where it's too much. And for everyone, that's a little bit different where that zone is. But the more that we are able to be aware of where we are and what we need and use that awareness to self-regulate with some of the tools we'll be speaking about in a minute, that actually really helps us to stay within that range of our optimal performance and has been shown to really boost professional performance. Next slide, please. So again, mindfulness practice can take a lot of different forms. There is no one way that you need to engage with this. If yoga or Tai Chi are things that you hate, that's fine. You don't need to decide that you love yoga in order to get these benefits. There are other things that can work well for you. And we can speak about some of that a little bit further. Next slide, please. But when we're really getting down to practicalities, what does the practice really look like? We know that consistent practice is really the key. So not just practicing once or twice a week, not just when you feel like you really need it. It can be helpful in those situations, but you're going to get the most benefit, and especially those long-term benefits that we had spoken about in last month's session, if you're really consistently practicing once or twice a day. And you can derive benefit from as little as 10 minutes a day. That's a study that recently came out that demonstrated this, and I've seen this with my own patients as well. And again, this can be formal practice. It doesn't have to be. But what I recommend to my patients, and what I think is really backed up in the evidence, is if you have a consistent practice 1 or 2 times a day, and then are really trying to bring an informal practice throughout your day. And so that informal practice of really just being aware and present as you go about your day-to-day business. This can be throughout your day, and then having specific practices that you use as needed when you're noticing that you're just not that present, or maybe your stress is coming up. And again, we'll talk in a minute about what some of those could be. Next slide, please. So these are some examples of informal mindfulness practices or informal self-care. It may be that what you really need is just to get down and have a formal seated meditation, and if it is, then great, go for it. If that is not you, or for some reason you're in a context where at this moment that is not the right thing, making sure that you're getting time to spend time with friends and family. Maybe you're going dancing or other physical activity. Maybe you just need a night of quiet. This is really related to the concept of just being aware of what is happening inside you, how high your stress is, what your need is right then, and being able to address it. Not in a way where you're hiding from it, but in a way where you're giving yourself really the space to process it and giving yourself what you need. Next slide, please.
I really like this Spider-Man ballerina.
Yeah, I always get a kick out of that one too.
Yeah, that was my favorite.
So how do we actually anchor in the present moment? We can go to the next slide here. There are a few guided practices that I can share with you, and these may look familiar to some of the folks who joined us last month. These are all apps that are, for the most part, free. Some have in-app purchases that I have found to be really helpful. They all take a variety of different approaches, but I think that they're really fantastic resources and are available on the fly whenever you need them. So whether you are interested in meditations through the Insight Timer or Headspace, guided visualizations through Guided Mind, some kind of basic biofeedback with Belly Bio, physical activities like some of the others are demonstrating here. These are some nice ways that you don't need to kind of figure out what you're going to do, and you don't need to walk yourself through it. You can have a guided practice where you are walked through. And that can be a nice way to kind of use some of these as tools in your toolkit for your own practice. Next slide, please. Eventually, though, when we're speaking about moving from having a mindfulness practice to mindful living, the transition there really means that we need to get from a place where we are just practicing our mindfulness when we are engaged in some sort of a formal, dedicated activity, to a state of mind where we're actually able to start using these practices and using this state of mind and tools and principles kind of throughout our daily life, moment to moment. And here are some examples of ways that we can do that. Now, these are not official names. These are names that I have created for these types of practices. And I can tell you that originally I developed these maybe 4 or 5 years ago to use with our residents at George Washington University. And eventually I came to realize, these are actually really relevant to everyone. I've been using them with my own patients for a while. So hopefully they'll be useful for you too. And I think we can think about these in the context of the sort of day that I think is really familiar to a lot of us, where you are kind of opening the day knowing that you have a lot that you need to accomplish. Maybe your schedule is looking pretty full. There are a lot of folks who are coming in and making requests of you or trying to share information with you from lots of different sources. Maybe that's via email, phone, popping their heads into your office. So you have sort of your schedule for the day, but then all these other things are sort of unexpected, unscheduled that arise, some of which may need to be dealt with rather urgently. So how do we manage this? One of the practices that I think can be very helpful is what I call the pause. And the concept here is that as you transition from one activity to the next, maybe it's from one meeting to the next, from one phone call to the next, email to email, as you're making that transition, to just take a moment. Just take a moment to say, okay, this meeting is done now. I've taken all the notes I need to take. I've delegated whatever I need to delegate, whatever it may be. I may come back to this, but this is done for now. I'm putting it away. and now I'm moving on to the next activity. And what that does, it allows your brain the opportunity to let go of that previous activity. So that instead of kind of rushing through your day and while you are on your fourth or fifth meeting, still having your brain back on the first one, you've now had the opportunity with each activity to just let go of the previous ones. Your brain is no longer trying to multitask everything else that you've done during the day. You have let it go and are really just consciously, intentionally focused on what you're doing now. A pause can be really effective. So this is one thing that you can do. The pinballing. Again, this is probably something that feels familiar. It's that idea of you're working on something, but you're hearing emails coming in and your phone is ringing. Maybe something arises that feels urgent that needs to be addressed right now. Rather than going down the path of kind of your immediate reflex reaction, which at this point probably you've honed very well, and maybe it feels more efficient to be able to do. When you spend a whole day doing that and kind of just immediately reacting reflexively to whatever arises, rather than forming an intentional response to it. At the end of the day, yes, maybe you addressed everything you needed to address. Maybe you were able to get everything done efficiently, but you feel as though the day happened to you. It acted upon you. As opposed to getting to the end of the day and saying, well, you know, maybe it didn't go exactly as I was planning. Maybe some things came up that were unanticipated. But I know that the responses that I gave to those issues that came up were appropriate and intentional, and I've lived the day. I was the one who was in charge as much as any of us ever are. That can make a really big difference in terms of that kind of day-to-day management of stress. So maybe something pops up and you can take a moment before you have that knee-jerk reaction to just say, okay, is this something that I really need to be addressing right now, or can it wait? If I need to be addressing it right now, let me take a moment to put away what I'm doing. Let me transition to this being the thing that I'm focusing on. And now I'm going to form an intentional response. It may or may not look the same as your knee-jerk reaction, but it makes an enormous difference in terms of where you are and the point at which you're working from. This is mindful living as opposed to reactive living. The next thing that we can think about is what I call the audit. So we've spoken a little bit about the idea that there are a lot of things that we can control in terms of our response to them. We know also that there are a lot of things that are maybe structural issues that may be creating some of the things that are arising that may be causing some stress or some triggers. Being able to really take a look at what some of those structural issues that may not be ideal for us are, being able to really take a look at them and identify them and make changes when possible can make a really big difference. So realizing that we don't necessarily need to be working within the system that we're working within. Non-judgment. So this is the idea of just noticing your patterns of thought and trying to engage with them productively. It's particularly relevant to patterns of thought that might be causing sort of casting blame upon you, anything that might be kind of negative self-talk. Oftentimes we're not even really aware of it. Being able to build your awareness of it and question it and try to redirect your attention in a way that's more productive is another thing that can be really, really valuable in terms of managing stress throughout the day and in terms of really encouraging more healthful behavior change over time. Practicing self-compassion is a closely related concept. Listening to your body. Again, the idea that, okay, well, you know, I am hungry or I do need to go use the bathroom, but, you know, it's just another couple of hours, and if I can just push through this and I'm done, there is hardly ever a situation in which we can't take the 5 or 10 minutes that we need to take to get ourselves some food or use the bathroom, if we really look at it. So I'll just pause there if there are any questions.
Yes, we do. Yeah, actually. Yes, we do.
Oh, we do. Okay,
yes,
great.
just popped in, and I didn't actually invite everyone. Make sure you can use that questions feature on the panel in front of you if you have questions for Dr. Baban. But this one says, is writing music a good daily practice to manage stress, considering we relive what we wrote about at that moment?
Sorry, writing music?
Yes, using music and writing music as a way to manage stress.
Absolutely. So music in all of its various different forms of engagement can be a great form of mindfulness practice. So writing music, absolutely. Writing anything really can be something that can be done mindfully and can be a really nice way to kind of process the day and process emotions. And we'll get in a minute to why that's important, especially when we're talking about sleep. People playing music, listening to music, these are all great forms of mindfulness practice. And remember, again, really anything that really speaks to you that you feel really engaged with can be a terrific form of practice to you. As long as it's something that you can really be intentionally focusing your awareness on and helping you to find a place where you are kind of centered and intentional rather than reactive.
Absolutely.
Yeah, it's a great idea.
I really liked this thing you just went through on living mindfully as far as the pause and the pinball. I feel like those are two things that we constantly are dealing with, right? As far as trying to multitask or engage 8,000 ways, which just doesn't ever feel right. We can't give our best to 8,000 things at a time, and so you always feel very stretched, right? And like just not.
We all think that we're good at it, and when we do the studies, we find that actually none of us are good at it.
Yeah, and it just really does lead to increased stress and frustration because we can't do anything our best when we're trying to spread ourselves so thin. So those are great.
That's exactly right. When we're trying to multitask, we are really demanding something of our brains that they are just, by design, not capable of. Our brains do not do more than one thing at once. We can very quickly switch between tasks, which usually means that we end up losing a little bit of our focus and sort of need to remember where we were before. But we really don't very effectively do multiple things at once.
Yes.
So when we try to ask ourselves to, it's just kind of setting ourselves up for that stress.
Yeah, you're like, I'm just doing a lot of things badly instead of,
Yes,
one thing really well.
But look how busy I am.
Yeah, right? I know. Yay me.
Right.
That's great. This is great.
So exactly right. So hopefully this is resonating. And I will have us go on to the next slide then. And we can just think a little bit here too, kind of we started to think about how this applies in a work environment. We know that when we are really using these kinds of practices, this is really supporting intentionally being able to place our attention where we need it, being aware when we are inattentive, when we sort of zoned out, and being able to bring our attention back, being aware of any internal dialogue or judgment in the way that I described, being able to really consciously engage with the system that we're working in, and thereby being able to make some positive changes where needed. Being able to maintain compassion and being perceived as more empathic, as well as experiencing more joy and meaning in our work. And again, you can imagine if you are successfully avoiding that sort of, zombie attempting to multitask state, how that could really have these sorts of benefits. So the next slide is a little bit of tongue in cheek. I have people sometimes who are sort of new to the concept of mindfulness who want a quote unquote checklist. Because mindfulness inherently involves the idea of being really present and responding to what's needed in the moment, a checklist is not exactly the way that I would suggest going about this, but we can think of it as a sort of guideline. If you're finding yourself in a situation where you really want to be practicing this concept of mindfulness, here are some of the things that we can pay attention to. So if it's a circumstance where it's you sitting across from another person, we can think about the importance of just being really conscious of maintaining eye contact, letting the other person know that they're there and you're paying attention to the other individual's nonverbal cues, as well as to your own, being aware of any emotional response you might be having or internal dialogue in that moment that might be affecting the way that you are reacting to this person. That can be something that's really beneficial in maintaining a good, open, and mindful dialogue. Finding an anchor. So if you have noticed that your attention has drifted away a little bit, whether in a conversation, in a meeting, sitting at your desk in front of a project, finding an anchor can be very helpful. And that can be something as simple as just saying, okay, I'm going to bring myself back. Let me just check in and just rest my attention on my breath for a moment and feel it in my chest. Maybe I'm going to just rest my attention on the feeling of my weight of my feet on the floor. Something that brings you back into the present moment and into your body, out of your brain, so that you can kind of reset and begin again with mindful presence. If you've noticed that your attention is divided, and perhaps that's unavoidable, or maybe you missed something important, acknowledging that verbally to the person that you're speaking with and being able to say, I really apologize. I just noticed that I seem to have missed something you said. Could you please repeat it? It allows an opportunity for an open dialogue and really letting the other person know that you value what they're saying enough that you would like them to come back to it. And in any interaction that's a little bit challenging, being able to name it, being able to say, I'm sorry, I'm realizing it feels as though there's a little bit of tension between us. Maybe we can take a look at what it is that's causing that. Or if there's something that I'm doing, I'd love to hear what it is that you're picking up on. These can be some of the things that can be useful in just maintaining a mindful dialogue. And when we're speaking about mindfulness practices, there's, as I mentioned in the beginning, as we spoke about a little bit last session, there is a lot of research and a great deal of implication in terms of how we can actually use these practices for our health needs. In the few minutes that we have left, I'm just going to spend a little bit of time in speaking about how we can use this in terms of sleep and managing pain, which are concepts that are often interrelated. So for the next slide, please. So insomnia, we think about being in a state of being tired and wired. The feeling that you want to go to sleep, you are tired, but you're not sleepy. We think about insomnia, it's defined as having difficulty falling or staying asleep 3 or 4 nights a week, so most nights of the week. This can be due to anxiety, it can be due to stress, or it could just be that you've had a really, really busy day and you haven't been able to process the day at all because you've just been in go, go, go mode, which some of those tools that we spoke about previously, using the pause, using the tyndall, can be helpful in addressing. Some of these factors, they can be recent, they can be chronic, but often they're described to me by my patients as, I just have so much trouble turning my brain off. And then before I'm even awake, it feels like my brain is already off and running. Next slide, please. So as it turns out, the American College of Physicians, based on a lot of research that's been done, has actually recommended mindfulness practice as one of the first-line ways of managing insomnia. Next slide, please. And so what does this actually look like? We can use mindfulness to really turn your sleep around. And so that can include things like giving yourself a 1-hour wind down. And there are lots of different things that we can do here, which includes making sure that the lights are dim, you're not using devices, your stimulation is minimal, maybe you're doing some gentle mindful movements like yoga stretches. But the concept here really being that you're using that hour as an opportunity to bring yourself out of all of the buzz and commotion of the day and back into the present and into a more, into a place of greater mindfulness. The body scan meditation, which is about a 30-minute meditation, what I would recommend, is terrific to be used either at bedtime if your difficulty is with falling asleep, or to be used if you find yourself awake in the night before you want to be, to help you return to sleep. I will be honest with you that I started using this meditation with my patients for other reasons when I first went into practice. And they kept returning to me and saying, Dr. Baban, I really love this meditation, but I keep falling asleep halfway through it. And so, this is something that I've repurposed now for that effect. And I find that my patients do really well with it. And I've provided you here with some resources that you can use that have versions of this body scan meditation. But essentially, just get yourself into bed in any position that you feel comfortable, that you think you can fall asleep in. Set the volume someplace where you can hear it, but it's not going to keep you awake. And just let it go. And generally, before the meditation ends, you will be asleep. It works really nicely. And that's especially if you've really allowed yourself that wind down period before bed. Mindful living, the types of things that we've been speaking about so far today, these take a really important role here. So it's really important to recognize that you cannot go, 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 go all day long and then expect to be able to flip a switch and fall asleep beautifully. Unless you are very sleep deprived, that's probably not going to work. And if you are very sleep deprived, then we need to address that issue. But being able to really take the time to give yourself a good baseline with a regular formal practice, being able to use your informal practices throughout the day in the way that we just spoke about, which allows you that opportunity to really kind of process over the course of the day so that your brain isn't stuck having to do all the processing at night when you're trying to sleep. And being able to take an audit, which can include things like, is my environment really conducive to sleep? You can keep a sleep diary. These are all things that are really effective. And of course, being able to speak with your physician to make sure that there's nothing else that's going on. Next slide, please. So there's a saying that having a really great night is dependent on having a really great and healthy day. So what you do during the day really matters, and it matters just as much as what you're doing as part of your nighttime routine. So here are some of the things that we want to make sure you're really focusing on. So making sure that you're getting physical activity, that actually helps to build up more of the sleep hormone in your body over time. So if once you get into a good routine with your physical activity, that's going to help to promote your sleep. Making sure that you're breaking up your sedentary time during the day, getting good bright sunlight in the morning, and avoiding bright lights at night, conversely. Avoiding heavy meals and alcohol and caffeine in the evening, and being really consistent with your sleep and wake hours can make a big difference. So next slide, please. If pain is an issue for you, if that's a particular challenge and related to your problems with sleep, we can go to the next slide. The American College of Physicians has also recommended mindfulness-based stress reduction, a lot of different mindfulness practices, again, as first-line management, particularly of lower back pain. And I can say I have a number of patients who have other pain, chronic pain conditions, including nerve-related pain, who do really well with these mindfulness practices. Next slide, please. And so the concept here is the same, having a scheduled practice 1 or 2 times a day, using your breakthrough practices kind of on the fly as needed. Pain visualizations can be a really helpful tool to use, and if anyone's interested, I'd be happy to discuss that more. But the idea really is being able to visualize the pain and then visualize it reducing or melting away can be very effective, actually. Our mind is very powerful. And we can really take a look at what types of practices might be best for you, in part based on what are the other benefits that you want to derive. If balance is something that you're working on, Tai Chi could be a great way to kind of get your 2 birds with 1 stone there. If you're a more analytical person, biofeedback could be a good choice. Walking meditations, if you're walking anyway, or your energy is particularly high, also a really good choice. Next slide, please. So really, these mindfulness practices can be highly effective. They are low risk and have great benefits and side effects. And they have a great evidence base. These are good ways to manage sleep, can be really beneficial for our physical and emotional health in the ways that we've discussed that are both physiological but also behavioral. You want to make sure that you have a practice that you really enjoy and that you can use consistently. And once you do, you often end up noticing that you're experiencing some overflow benefits in the other areas of your life. Next slide, please. These are some additional resources that I am going to just mention here. Software to the left and websites that may be useful for some additional research or just other places that you can look for tools if you're interested. And some books that may be of interest. Why Zebras Don't Get Ulcers, I think, is a really particularly nice one. Next slide, please. So I just kind of get a kick out of this. We have the Swami saying, live each moment, practice being mindful, be present. Hold on, I have to take this.
I laughed at that.
I think sort of sums up our daily struggle, right?
Right. I'm in the zone, but hold on, I can't stay in the zone.
Right. But the practice is coming back and being aware.
Exactly. I'm pausing and coming back. That's great. We do have a question about biofeedback. Can you explain that just a little bit for everyone?
Absolutely. So biofeedback is generally the concept. Generally, the way that biofeedback will work is that you have a mindfulness practice that you are engaging in. As any one of the kinds that we've spoken about, often involving kind of focused attention on the breath, but not necessarily. But while you are practicing your mindfulness, you will simultaneously be given some sort of a real-time feedback regarding how your body is responding. So a classic type of biofeedback is one in which you may have a mindful breathing meditation that you're doing, and while you are doing it, maybe you have some sort of a visual readout that's showing you how your heart rate variability is responding, for example. And that is a marker for how much you are engaging that relaxation response. So we can really see physiologically what are the things that are changing when you reach that mindfulness state. And oftentimes for people who are having some difficulty really seeing if they're in that mindful state, or who just feel as though they're out to a good start but would like to be able to kind of refine their mindfulness practice and go deeper with it, that kind of feedback can really give someone a good sense of kind of what they're doing that is working, quote unquote, and when they might want to refine their mindfulness practice approach.
That's very cool. It gives you some actual analytical feedback, right? As far as
exactly
what you're attempting
right
to do.
So I find this is a really particularly good fit for people who are more scientific or analytically minded, or even just for folks who say, I'm finding that I'm really having a difficult time resting my attention on my breath. I think if I was getting some real-time feedback, that would help me to sort of keep my attention focused. Sometimes for my patients who have really high anxiety, particularly folks who are prone to panic attacks, this can be a particularly good form of practice for them.
Yes, and that's what I've heard it used for a lot, honestly, is for that anxiety and panic, those symptoms. So that's very
Yeah, I
cool.
think it can be a great fit then. But I do also sometimes have folks who say, listen, you told me all the research I know, but still it feels sort of, woo-woo. I need something with evidence and with some numbers attached to it. So the biofeedback can be a great fit there too.
Yeah, so it can be actually measurable in numbers.
Yeah,
So
right.
very, very neat. Well, thank you so much for this and all the help that you've given us and all these tools. I loved your list of tools. I loved the list of resources, the different apps and books and ways we can actually take it and apply it with some guidance there on how to make it happen in our lives. Can you tell us again how we would get in contact with you if we wanted to come see you as a patient, either
Yeah,
in
absolutely.
person or even, I don't know if you can do remote visits. How do you do that?
So we are actually in the process of getting that set up now, and I'll be happy to share that information with you, Anne, when we have it completed. For anyone who's in the DC area and would like to come in and see in person, we do have a very easy way to establish an appointment. I can give you the phone number for anyone who's interested. So that's area code 202-741-2222. Or if you're comfortable with it, Anne, I'm also fine having anyone contact you, and then I'd be happy to help arrange getting them set up.
Yes, absolutely. And that's what I was going to say as well. You can just contact us here, leave a note on as you check out, and we'll help you get in contact. But thank you so much for sharing that number and for everything you've shared with us today. For those who are on, here we'll apply your points that you receive for participating in health promotion today, and then also this recording will be available on your account at myoriant.com and a copy of the slides as well, so you can always access them or re-listen later if you'd like. So Dr. Baban, thanks again for doing this for us today. I really appreciate it. And
well, thanks so much. It was my pleasure.
We're looking forward to more from you down the road. We've talked about possibly scheduling something down the road, so we really appreciate your willingness to come present with us today.
Well, then I would make a special request if anyone is interested, anyone who's listening. If there's something specifically you'd like us to focus on, please just let us know.
Yes, absolutely. I second that wholeheartedly. So, all right. Well, we'll go ahead and sign off for today, and thanks for joining us, everyone.
Terrific. Okay, thanks very much. Bye-bye.
Thank you. Bye.